With me now is Dr. Dean Sidelinger, Oregon's Health Officer and State Epidemiologist. And Dr. Sidelinger, thank you for being with us today. We appreciate it.
Thanks for having me.
Let's talk about it. Oregon, Washington, California, Hawaii, now part of a West Coast Health Alliance. Why was it necessary to form that alliance?
A group amongst the four states, California, Hawaii, Oregon, and Washington, to come together to look at the data, the science, and to make evidence-based recommendations for the people of our states and to recommend things to our governor to help protect people in our states. And we're going to start with respiratory virus vaccines because the fall respiratory season is upon us.
Tell us how Oregonians will benefit from this alliance.
Unfortunately, what we're seeing right now is confusion. The federal government has changed vaccine recommendations without transparency, without showing the data behind them. And, that could potentially put people in Oregon and our fellow states at risk. So we're going to look at what does the data show? Who's still being impacted by these diseases? Who's getting sick? Are there any safety signals or safety concerns that we're seeing as we continue to monitor these vaccines? And who could benefit most from receiving these vaccines? Then together, the four states will make the same vaccine recommendations so that the people in our states, the providers who are providing those vaccines have one set of recommendations to follow to help protect the people in our states and ensure that less people come down with complications from these diseases.
Vaccine opponents, as you know, say an alliance like this is a way to promote a political agenda. You have Oregon, Washington, California, Hawaii, all blue states, of course, and they say this is all political. And you say what?
The only agenda I'm promoting and the fellow health departments are promoting is the health of people in our states. We want to preserve access to these vaccines, which save lives, prevent hospitalizations, and prevent illness. And looking at the data, we can see who's still getting sick, who's most likely to have complications. And we want to make sure that in our states, in Oregon, that we have recommendations that support those most impacted to be able to have access to these vaccines so they can make the choice to protect themselves and their family and their children.
You talked about the turmoil at the CDC. Tell us how that's impacting Oregonians and the response to vaccinations right now.
So let me go back to how things used to work, say through 2024. The CDC would bring together expert advisors who were independent, who would declare any conflicts of interest they had, and who would review the data on who's being impacted by disease. For a vaccine, they would look at the safety of that vaccine and any safety concerns that came out in a new vaccine or that we would see while the vaccine is being used, and how well that vaccine works, not just at preventing disease, but also at preventing hospitalizations and deaths. They would make a recommendation, which would be adopted by the CDC, and that would set into motion a series of things like coverage for that vaccine for children on Medicaid, for children without insurance. For those of us with private insurance, it would ensure that we could get that vaccine without any copay, without paying any dollars. That all fell apart this year with the mass firing of those independent advisors and vaccine decisions being made without data. So this West Coast Alliance will bring that system back as best we can to make recommendations, and then we can work on policy and other measures within each individual state and try and ensure people have access to those vaccines and that they're still paid for. But this will take some time. This was all automatic at the federal level, and with that dismantling now, we're in a system where each state has to rebuild those systems individually.
When do you expect to come out with some information from your alliance?
I think we expect in the coming days to finalize some consensus recommendations we've agreed upon for COVID-19, influenza, and RSV as we go into the fall respiratory season. As you know, there have been significant changes at the federal level for COVID-19 recommendations. So that's what we're working on right now, meeting and discussing the evidence so that we can give people in Oregon and our other West Coast states the best information so they can make decisions about choosing vaccines for their family.
Have you heard much from the Trump administration when it comes to forming this alliance?
I've not been paying attention, and I think what we're focused on is looking at the data and putting forth guidance and then working on policies to support access to vaccines in accordance with that guidance. Right now, what I'm hearing is a lot of frustration from people who can't access vaccines at the pharmacy like they could because of those federal changes. So we're working as quickly as we can with the Board of Pharmacy, with our pharmacy partners, to try and reinstate that the rules that people can go into the pharmacy and get the vaccines that they've chosen to get over the last several years in those locations.
What is Oregon's vaccination rate, doctor, when it comes to children right now?
When it comes to children overall, we have one of the higher exemption rates for kids coming into kindergarten, meaning more parents have chosen to exempt their children from vaccines than in many other states. So we continue to work to put out the best evidence-based recommendations we can, communicate with people, trying to address their concerns. That's overall vaccination rates for children. In Oregon, as in most other states, we have a fairly low uptick of COVID-19 vaccines in children, but we want to ensure that children who have underlying medical conditions, our youngest children, those under 2, have the second highest rate of hospitalizations due to COVID. And any parent who chooses to protect their child with vaccines has access to that vaccines. And right now, the federal rules don't support that. The federal recommendations don't support that. So we want to assure that here in Oregon, we have that support for parents to choose those vaccines for their children to keep them healthy.
What do you say to those parents who are skeptical about having their kids vaccinated?
I want to say that, again, we know that kids overall have less complications from COVID than older adults. But again, the second highest rate of hospitalization for COVID is in our youngest kids, and that kids with underlying conditions and even healthy kids can have complications. We've been using vaccines against COVID-19 now for about 5 years, and we've continued to look at the safety of those vaccines. These vaccines are very safe, and they keep people out of the hospital and they keep people from dying. We know that we had some serious problems with the Johnson & Johnson vaccine after it came out with blood clots in the brain. That vaccine has been removed from the market. We know that in a very small number of people who get some of the mRNA vaccines, that we can see inflammation of the heart. This is primarily in adolescent boys, and the risk of that inflammation following the vaccine is actually much lower than the risk of getting that same inflammation with COVID. So I want to tell parents that these vaccines have been used for many years now in millions of people, and they are safe. And they are working to keep people out of the hospital and keep people alive. They've saved millions of lives. And if parents still have questions, I urge them to talk to their pediatrician or their other medical provider to get those questions answered so that they can make the best decision to protect their children.
Oregon took a cautious approach to COVID-19 with the masking, the closing of the schools, and a vaccine passport. What's your response to people who say actions like this put ideology over science when it comes to public health policy?
I would have to respectfully disagree. What we're trying to do in Oregon and our fellow West Coast Health Alliance states is to maintain access to vaccines that work and that are safe. These policies make sure that people can make that decision to go to a pharmacy and get vaccinated, to talk to their pediatrician to get their children vaccinated. And we want to maintain access to these vaccines. On COVID-19 specifically, COVID-19 hasn't gone away. We're just starting to come down from what we would call our summer surge. Probably all of us have either been sick ourselves or know a family member, a loved one, or friend or coworker who's been sick, because COVID was circulating fairly widely in our community. And COVID-19 still kills about 200 Americans a week right now. So we want to make sure that people have access to this vaccine as we move into the fall respiratory season, and know that this virus will come back in the fall and in the winter, and that they can make a decision to protect themselves, their families, and the loved ones around them.
What is your role in the alliance?
I think right now the governors have directed public health in each of their states to work together. So I, along with Dr. Hathi, along with Naomi Adeline Biggs, our public health director, work together with our counterparts in the states of Hawaii, California, and Washington to discuss issues that come up, to talk about some of those barriers to access, like in pharmacies, how we may pay for vaccines that the federal government may pay for, and share those ideas so that we can implement policy to support access to choice for vaccines in our states. And so we're starting to meet fairly regularly and have those discussions.
Oregonians are just hearing about this for the first time, a lot of folks. What is your message to them about this newly formed alliance?
This newly formed alliance works to make sure that we don't take our eye off the data and the science, and that we are transparent about decisions that we're making so that we can tell you who's still being impacted, for example, by COVID-19, by flu, by RSV, three of the big viruses that circulate in the fall and through the winter, so that we can tell you about the vaccines that are available and how well they work, so that we can tell you about the safety signals. We do not see safety signals with any of these vaccines. And in fact, the RSV vaccine, which is probably one of the newest vaccines given to older individuals, pregnant people, and young infants to protect those who are most vulnerable, we've seen dramatic decreases in hospitalizations and impacts from RSV just in the last 2 years as we've been using this vaccine. And that's great for families to keep their children healthy, to keep them out of the hospital, and make sure we don't see the tragedy of losing a child to a preventable disease.
You are a busy guy, so Dr. Dean Sidelinger, thank you very much for your time. We appreciate it.
Thanks for the discussion.
You bet.